Hey everyone, and welcome back to another episode of Tachy Tuesday. If this is your first time tuning in, welcome. Tachy Tuesdays are the EMS Cardiology series that I do every single week, and I try to keep my lessons under 5 minutes. Today we're going to be talking all about Inferolateral MIs. So let's talk about what an inferolateral actually is. And inferolateral is such a weird word because it comes from inferior and lateral. And to me, I feel like it should be inferiolateral, but I didn't make up the rules. So an inferolateral MI is a type of heart attack that typically indicates an occlusion of the right coronary artery, or also known as the RCA, or the left circumflex. This directly affects the blood flow and the oxygen delivery throughout the heart. Going into the characteristics of an inferolateral, specifically the ST elevation you will look for. So in an inferior MI, you're looking at elevation in leads 2, 3, and AVF. And your lateral leads are lead 1, AVL, V5, and V6. But whenever we're talking MIs, you can have a high lateral MI or a low lateral MI, or you can have an MI that includes lead 1, AVL, V5, and V6. So going into the reciprocal depression of those, in your inferior, you can expect to see reciprocal depression in AVL and lead 1. In your high laterals, you can expect to see reciprocal depression in leads 2, 3, and AVF, and your low lateral, you can expect to see reciprocal depression in your septal leads, V1 and V2. Special instructions for this type of heart attack is the same as an inferior MI because it is involving the inferior portion of the heart. You want to move V4 over to the opposite side and check for ST elevation. If you observe ST elevation, then that is going to indicate possible right-sided involvement, and that is when you want to hold off on any administration of nitroglycerin, etc. So just to recap, you may have an inferolateral that includes all the inferior leads and only the high lateral leads, or the inferior leads and only the low lateral leads, or it could be the inferior leads and all of the lateral leads. I hope that makes sense. The causes and risk factors for this type of MI are pretty much the same as any other heart attack: hypertension, smoking, high cholesterol, diabetes, arterial plaque, obesity, advanced age, drugs and stimulants, autoimmune diseases, family history, inactive lifestyles, heart disease, metabolic syndrome, and stress. It's pretty crazy to think that stress can cause a heart attack, but it definitely can, especially if it's prolonged stress that has happened over an extended period of time. Some of the signs and symptoms can be abdominal pain, chest pain, back and jaw pain, nausea and vomiting, heartburn, headache, shortness of breath, dizziness, diaphoresis, and fatigue. Let's go ahead and take a look at an inferolateral on an actual 12 lead. All right, taking a look at this 12 lead, let me give you just a little bit of a backstory. Our patient was a male in his early 20s. In 2, 3, and AVF, you do see some elevation. And I will say this is just one of the 12 leads I got. It definitely progressed over time. You're going to see elevation in V5 and V6. You also see elevation in 1 and AVL. So this one included the entire lateral wall. It was lead 1, AVL, V5, and V6. So typically your reciprocal depression is going to be seen in your septal leads, which are V1 and V2 for a low lateral heart attack, and you do see some ST depression in those leads. Like I said, this was a young male. He had no cardiac history or really any family history of heart attacks young or anything like that, but many young people are drinking energy drinks now. They're using different pre-workouts or stimulants, caffeine pills, etc. to keep them awake and or give them more energy, and these actually can lead to cardiac events. Let's go into some of the 911 EMS treatments for this. So out in the 911 EMS setting, you definitely want to get a 12 lead and vitals on this patient. This is where you're probably going to discover that they are having a cardiac event. You want to give them oxygen, and I did put in here to avoid hyperoxemia. And basically what I'm getting at with this is if you have a heart attack patient that already has an O2 saturation of 94% or above on room air, supplemental oxygen is not needed, and it is actually proven that it can be very detrimental to the patient and increase the overall injury to the heart. So you want to titrate to this area. So let's say they have an SpO2 of 89%, then you might want to put them on a nasal cannula at 2 or 3 liters per minute. The main thing is you don't want to hyperoxygenate them and cause more of an issue for them later on long term if they were to survive this cardiac event. Obviously IV access and blood draw, aspirin. I put nitroglycerin here, but this all depends on on if there is right-sided involvement. Make sure you move that V4 over and look for ST elevation, and always check their blood pressure before you give nitroglycerin. And the next is a narcotic analgesic like fentanyl or morphine. And if they do have low blood pressure, I didn't put it on here, but you can always consider fluids. You want to treat your patient's complaint and report and transmit any findings to the hospital. Main thing is just talk to your patient, see how they're feeling, and keep them as calm and stable as you possibly can. Anyway, guys, that's about all I have for inferolateral MIs. I hope you learned something. Thank you guys so much for watching, and I'll see you next week. Bye!